So I see more and more fatty liver disease in my clinic than I ever have before. In fact, did you know that the number one reason of liver failure is fatty liver disease? That's crazy. Well, in today's video, I'm going to give you 10 lifestyle tips that I recommend to all my patients who have fatty liver disease so we can make sure you don't suffer from this condition and that you don't end up having liver failure as well. Howdy, Dr. Islam here, aka your poop guru and your fatty liver disease expert. I'm a board certified gastroenterologist trained at the Mayo Clinic from CSL Gastro for all your GI needs. Now, before we start, don't forget to like, share, subscribe so you can get more videos just like this. So who am I? So why should you listen to me? Well, I'm a board certified gastroenterologist trained at the Mayo Clinic. I've treated over 10,000 patients with fatty liver disease in my past 10 years as a board certified gastroenterologist. And in fact, I have actually helped cure patients and reverse the liver disease with these lifestyle tips. So these are tips that I recommend to my patients and I'm hoping to give to you as well. So tip number one, and it's the first one on this list, is weight loss. By far, the most effective treatment you can do for your liver is to lose weight. It's not like you have to lose a ton of weight. 10% of your body weight is all you need to make the changes in your liver and to get you the success that you need. It's not that much. It's not like you have to lose 30 pounds or 40 pounds or 100 pounds. Now, certainly you can do that, but losing just a little bit of weight is gonna make a huge amount of difference. Out of all the things you can do, this is the best bang for your buck. Now, there's not gonna be one right thing that you can do that's going to guarantee you to lose weight. Everybody is different and different diets work for different types of people. And for some individuals, they actually may need medical therapy and surgical therapy to help them lose weight. Not a big deal, but find some way for you to lose that weight so you can get on track for getting your liver taken care of. Now, tip number two is to follow what's called a Mediterranean diet. Now, out of all the diets that are out there when it comes to fatty liver disease, whether it's keto diet, carnivore diet, whatever diet, the best diet that has the best evidence is what's called a Mediterranean diet. This is a diet that's full of plants, vegetables, fatty fishes, and healthy nuts. This has the best research and the best evidence to actually reverse fatty liver disease. Let me tell you about a patient of mine. I actually had a 38-year-old female who was suffering from fatty liver disease. In fact, her liver disease was so bad, I was worried that she was going to need a liver transplant. And so I talked to her, hey, we need to make changes right now because the next conversation may be one in which I have to tell you, you have to get a new liver. So I told her the best diet you can do is to be on a Mediterranean diet. And I told her out of all the evidence, this is the diet that actually works. 3 months later, I came to see her, and guess what? She actually reversed the damage in her liver. It went back to normal. And yes, your liver can do that. And all she did was get on a Mediterranean diet. And an added benefit was that she actually lost weight. So she killed two birds with one stone. So out of all the diets that you can do, the Mediterranean diet has the best evidence to decrease inflammation in your liver. Now, this can help out with other conditions, high cholesterol, high blood pressure, heart issues, and fatty liver disease. And I have a whole video on this diet that you should watch at the end of this video so you can make sure you get the best information on what you can do for your liver. Tip number three, drink coffee. Say what? Yes, there's evidence to suggest that black coffee, 2 to 4 cups per day, caffeinated or decaf, can actually reverse the damage in your liver. What we think is going on is the antioxidants that get produced with coffee can decrease the inflammation and the scarring in the liver to actually reverse liver damage. Now I have to tell you, and I tell all my patients, this is not your Starbucks Frappuccino full of sugar, full of milk, full of all the junk. No, that's not the coffee that you want. You need straight up black coffee. Now it can be decaffeinated, that's fine. This is one of the things that I recommend to my patients. I do this myself. There are so many benefits with black coffee. It can decrease your risk for developing heart disease. It can decrease your risk for liver disease, and it's actually good for you as well. So try to incorporate black coffee in your life. Tip number 4 is exercise. Exercise is critical for curing fatty liver disease. Scratch that. Exercise is critical for everything. Guess what? Exercise is free and it actually works. It can help you lose weight, it can make you feel better, it can decrease your risk for developing cancer, and the physical act of exercise, that alone can actually reverse the damage in your liver. In multiple studies, they have stratified patients to actually do exercise and not do exercise. And even just a little bit of exercise has been shown to reverse the damage in your liver. Now, the best thing you can do is to do a high aerobic activity, maybe 3 or 4 times per week for at least 30 minutes per session. This is the optimal thing that you can do, but even something is better than nothing. What I do is I try to work out every single day. It keeps my liver in shape, it keeps me in shape, it makes me feel better as well. There's so many added benefits with exercise that it boggles my mind why people are not even considering this as a first-line option to get their health back on track. Now, it's recommended that you do moderate level of activity, at least 150 minutes per week. It's really not that bad. It's only 30 minutes a day for 5 days a week. That's it. 30 minutes to save your life and to save your liver. Listen, you can do it. I know you can. Tip number 5, avoid added sugar. Sugar is in everything. It is crazy. It's in mayonnaise. It's in bread. It's in ketchup. And this is sugar that's already added into what already is in there. The biggest culprit is called high fructose corn syrup. This is what you need to look for in the ingredients. This plus sucrose gets built up in your liver and causes damage to occur. That sugar is actually a toxin to your liver. It causes damage, inflammation, and eventually what's called fibrosis, scarring, and liver disease like cirrhosis. Because everything's pretty much prepackaged or processed, look at the ingredients. If there's anything like fructose, sucrose, or maltose, these are added sugars. Avoid it. And also keep an eye out for other sugars. Things like cane sugar, high fructose corn syrup, and fruit juice concentrates. Tip number 6 is to target and remove high cholesterol from your diet. Cholesterol disease is a risk factor for not only heart disease, but also liver disease as well. And so we want to do what we can to eliminate any excess damage to your liver. So be on the lookout for trans fats and saturated fats, because these are fats you don't want to have in your diet. Tip number 7 is consider taking omega-3 supplement. Now, I talked about how to avoid fats, but actually omega-3 is actually a supplement that actually is a good fat for you. You have good fats and bad fats, and omega-3 certainly is a good fat you want to incorporate in your diet. In fact, these types of fats are incorporated in the Mediterranean diet. Now, these have been shown to decrease your risk for developing liver disease and cholesterol issues as well. So taking an omega-3 supplement can go a long way for fixing your liver and fixing your cholesterol. Tip number 8 is avoid the things that irritate your liver. Things like alcohol, which we know you shouldn't be doing. Alcohol is not good for you. There's been so many studies showing that even a little bit of alcohol can be detrimental for your health, and certainly it can be damaging for your liver. But other things like non-steroidal anti-inflammatory medications, things like Aleve, naproxen, Advil, Motrin, these are not good for your liver. However, Tylenol in the recommended dose typically is okay, so don't be worried about that. But things like a liver detox, don't take. Herbal supplements, don't take. So the key to having a good liver is to make sure you don't take the irritants that are destroying your liver. Tip number 9, consider adding healthy supplements to your liver. These include things like turmeric, green tea, garlic, and ginger are really effective options to naturally get your liver taken care of and get you feeling better. And then tip number 10, do not take a liver detox. I know I mentioned this before, but I want to stress this one more time. Do not take a liver detox. I had a patient of mine who was the young patient that had fatty liver disease. And I told him all my whole spiel. Diet, exercise, avoid the things that irritate your liver. And guess what he did? He took a liver detox. He saw me a couple of weeks later and he was yellow. He was yellow. He felt terrible. I was like, what the heck is going on? We did some blood testing, and guess what? He actually went into liver failure because of the liver detox pill that he took. So do not take a liver detox. Don't take a pill that's going to cure your liver or detoxify you. In fact, most of these pills actually have ingredients in them that are terrible for your liver. So do what you can to protect your liver from these detox medications. So there you have it, 10 lifestyle changes that I recommend to all my patients who have liver disease. If you do this, you're doing what I recommend to all my patients as a board certified gastroenterologist and liver specialist. If you have any questions or you want to go into more details, don't forget to leave a comment down below, like, share, and subscribe. Did you feel like you got good value from this video? I hope so, because if you did, I want you to do 2 things. subscribe to my newsletter, but also if you're here, come see us up at Gastro, where we take care of all sorts of conditions, including liver disease. Thank you for watching. Don't forget to smash that like button, like, share, and subscribe, and we'll see you guys in future videos.